ಸರ್ ನಮಸ್ತೆ, ನಾನು ಶಿವಣ್ಣ ಅಂತ ಕ್ಯಾಸಂಬಳ್ಳಿ ನಮ್ಮದು. ನನಗೆ ಒಂದು ಸ್ವಲ್ಪ ಹೆಲ್ತ್ ಅಪ್ಸೆಟ್ ಆಗಿತ್ತು. ನನಗೆ ಇದು ಸ್ವಲ್ಪ ಈ ಬ್ಲಡ್ ಮೋಷನ್ ಆಗ್ತಾಯಿತ್ತು, ಬ್ಲಡ್ ವಾಮಿಟ್ ಆಗ್ತಾಯಿತ್ತು, ಸುಸ್ತಾಗ್ತಾಯಿತ್ತು. ಯಾವಾಗಲೂ ಏನು ಕೆಲಸ ಮಾಡೋಕ್ಕಾಗ್ತಾಯಿರಲಿಲ್ಲ. ನಮ್ಮ ಏರಿಯಾಗಳೆಲ್ಲ ತೋರಿಸಿದ್ವಿ ಹಾಸ್ಪಿಟ್ಲಲ್ಲಿ, ಏನೂ ವಾಸ ಆಗಿರಲಿಲ್ಲ. ಆಮೇಲೆ ನಮ್ಮ ಪಕ್ಕದ ಊರವರು ಹೇಳಿದ್ರು, ಈ ಥರ ಮಣಿಪಾಲ್ ಹಾಸ್ಪಿಟಲಲ್ಲಿ ಒಳ್ಳೆ ಡಾಕ್ಟ್ರ್ ಇದ್ದಾರೆ, ನೀವು ಹೋಗಿ ಒಂದು ಸಲ ಕಾಂಟ್ಯಾಕ್ಟ್ ಮಾಡಿ ಅಂತ ಹೇಳಿದ್ರು. ನಮ್ಮ ಡಾಕ್ಟ್ರು ಬಾಲಾಜಿ ಬೆಲ್ಲದಂತ ತುಂಬ ಒಳ್ಳೆ ಡಾಕ್ಟ್ರ್ ಸಿಕ್ಕಿದ್ರು, ತುಂಬ ಚೆನ್ನಾಗಿ ನೋಡಿದ್ರು.
Hi, I am Dr. Balaji Laxminarayanshetty, medical gastroenterologist working at Manipal Hospital Whitefield in the Department of Gastroenterology. Here we have a gentleman, he is 60-year-old and he was a known case of chronic liver failure. Previously he had multiple episodes of blood in the vomitus, for which he had undergone multiple times endoscopy and endoscopic therapies outside. So when he had presented to us, his BP was 70 systolic, and immediately we did him an endoscopy. We saw that his stomach was full of blood. We could not identify where he was bleeding, and we could not see anything. And the other thing, that he was almost verge of collapse. Immediately we shifted him for a CT scan. He had a large gastric varix which was actively bleeding, and there was a large shunt draining to the gastric varix. Then we formed a team with our advanced intervention radiology and with the backup of our GS surgery department. We all discussed and we thought that intervention procedure would definitely help him.
Hi, I am Dr. Nagbhushan. I am the intervention radiologist here in Manipal Hospital Whitefield. I saw Mr. Shivanna on that day in the emergency suite when he came with bleeding from the stomach wall. So he was diagnosed to have some dilated or engorged vessels which were bleeding from the stomach wall. So we had to take him for an emergency procedure. This procedure on that day we did is CARTO. CARTO, the full form is coil assisted retrograde transvenous obliteration of varices. Immediately the bleeding stopped, and the next following 48 hours when we checked him on the CT scan, there were no varices found, and now it is almost 3 years and he is literally free from any bleeding from this particular pathology.
The moment we did the procedure, his BP normalized. The next day when we did an endoscopy, all the blood in the stomach was disappeared.
3 ವರ್ಷ ಆಯಿತು, ನನಗೇನು ಪ್ರಾಬ್ಲಮ್ ಇಲ್ಲ, ಆರೋಗ್ಯವಾಗಿದ್ದೀನಿ. ಅವಾಗವಾಗ ಡಾಕ್ಟ್ರು ಫೋನ್ ಮಾಡಿ ವಿಚಾರಿಸ್ತಾ ಇರ್ತಾರೆ.
Since 3 years now, there was no bleeding recurrence. Before that, every fortnightly he used to bleed, and he had a recurrent hospital admission and a lot of financial burden on the patients. After this procedure, we are happy that he is free from his disease, and his financial burden also has come down.
ನಮಗೆ ವೈಟ್ಫೀಲ್ಡ್ ಮಣಿಪಾಲ ಹಾಸ್ಪಿಟಲು ಡಾಕ್ಟ್ರು ಬಾಲಾಜಿ ಬೆಲ್ಲದವರಿಗೆ ನನ್ನ ಲೈಫು ಇರೋವರೆಗೂ ಅವರನ್ನು ಕೃತಜ್ಞತೆಗಳನ್ನು ಅರ್ಪಿಸ್ತಾ ಇದ್ವಿ. ನಮ್ಗೆ ಹಾಸ್ಪಿಟಲಲ್ಲಿ ತುಂಬ ಸೌಕರ್ಯ ಮಾಡಿ, ಹಣದ ಕೂಡ ಸಹಾಯ ಕೂಡ ಮಾಡಿ, ಕಡಿಮೆ ಮಾಡಿ ನಮ್ಗೆ ತುಂಬ ಆರ್ಥಿಕ ಸಹಾಯ ಕೂಡ ಮಾಡಿದ್ರು. ನಾವು ಲೈಫಲ್ಲಿ ಅವ್ರನ್ನ ಮರೆಯೋಕ್ಕಾಗಲ್ಲ. ಹಾಸ್ಪಿಟ್ಲ್ ಕೂಡ ನನ್ನ ಒಂದು ಕೃತಜ್ಞತೆಗಳನ್ನು ಅರ್ಪಿಸ್ತಾ ಇದ್ದೀನಿ ಸರ್. ಥ್ಯಾಂಕ್ ಯು ಸರ್.